Well, today is the day we expect a major update about the future of the Johnson & Johnson COVID vaccine.
As you know, that J&J shot has been on hold for more than a week after reports of a few blood clots. News 8's Allison Royal joining us live in Chula Vista with a closer look at what we can expect with this shot. Good morning, Allison.
Good morning, Netta and Eric. Well, Europe was a lot like us. It decided to pause the use of the Johnson & Johnson vaccine, but it's giving it another go. But this time it's going to attach a safety warning to the Johnson & Johnson vaccine. So the FDA here is likely to make a similar decision and issue a safety warning. But let me give you some background so we can understand how we got here. This decision was made after fewer than a dozen people had blood clots, which is still considered rare when you factor in the overall number of people that have chosen to get the Johnson & Johnson vaccine. The Johnson & Johnson vaccine also has a convenience factor to it, maybe some appeal since it's easier to refrigerate and only requires one dose. Right now, there are about 10 million doses of the Johnson & Johnson COVID-19 vaccine that are sitting in a refrigerator somewhere in the United States awaiting approval from scientists that are advising the CDC. The CDC will meet later today for 6 hours to discuss the possible benefits and cons to the Johnson & Johnson vaccine. Now, this comes as many Americans have questions about whether or not the vaccine is something they are interested in getting.
If something health related pops up in my life, I'm always like, is this new or is this COVID related?
And that was a COVID long hauler in another state. And speaking of other states, the vaccine supply and demand is starting to change. Fewer people are interested in receiving the vaccine, according to Dr. Anthony Fauci. So, for example, in Kansas, 60 counties denied any new shipments of coronavirus vaccines this week, saying that they were worried they would go unused and wanted to free them up to other places that might need them more. Netta and Eric.